Hello everyone, my name is Victoria. I am a nurse with a specialist interest in diabetes. I'm currently a master's student of University of South Wales. This morning I'll be talking about macrovascular diseases and diabetes. But before we go into that, I'll be giving a brief overview of diabetes and the complications of diabetes. So, what is diabetes? Diabetes is a lifelong progressive metabolic disorder affecting the pancreas, leading to the inability to produce enough insulin or failure to utilize the insulin produced by the body. We have two major types of diabetes. We have the type 1 and we have the type 2 diabetes. We also have other types of diabetes which might include the gestational diabetes, type 3C diabetes, steroid-induced diabetes, and other types of diabetes. The incidence of diabetes is quite high, with about 1 in 5 people over the age of 65 years old living with this condition. Today we'll be talking about the complication of diabetes. We have two major types, which are the microvascular and the macrovascular. Today we'll be talking about one of these arms of complications, but before we do that, I'll talk briefly about the two complications and then we'll go into the one we'll be talking about. So, macrovascular complications. From these two major words, macro and vascular. Macro means large, while vascular means blood vessels. So this means these are the complications affecting the larger blood vessels of the body. And when we talk about larger blood vessels, we talk about those supplying the heart, the brain, and those larger blood vessels that supply our arms and our legs. The good thing about diabetes is it can be managed and these complications can be prevented. But when they happen, we need to know how to manage them and how to make sure they do not progress to the deadly stage. So, microvascular, on the other hand, talks about the small from micro and vascular blood vessels, that is the small blood vessels, the complications affecting the small blood vessels of the body. And that is here we talk about those supplying the kidneys, the eyes, and the nerves. One thing we need to know about these complications is the major culprit is hyperglycemia, that is high blood glucose. They are the major cause of these complications happening, although there are other risk factors that are associated with these complications. Today we'll be talking about the microvascular complications, but before I go into that, I just want us to know that the macro, the large blood vessels, which we will not be talking about today, the complications might include stroke, which we know known as cerebrovascular diseases, the coronary artery diseases, peripheral vascular diseases, and so on and so forth. Anything that affects the heart, the large blood vessels supplying the arms and legs, and the brain. To the microvascular complications, that is small and blood vessels, which we'll be discussing today, are those affecting the kidneys, the eyes, and the nerves. When there is damage to the blood vessels supplying the kidneys in a person living with diabetes, it is known as diabetic nephropathy. Diabetic nephropathy, nephropathy. Diabetic nephropathy, also known as diabetic kidney disease, is one of the complications of diabetes that interfere with the kidney's ability to perform its function of excreting waste materials and preventing fluid buildup. According to Diabetes UK 2019, about 1 in 5 of people living with diabetes have this condition, and over 10,000 of people living in the UK with diabetes will have to be treated for end-stage renal disease before they die. End-stage renal disease is a very severe complication affecting the kidney. Signs and symptoms might not be obvious in the early stage, but as the disease progresses, signs such as swollen ankles, tiredness, blood in the urine, and shortness of breath can be seen. Then we move to the second complication, which is the one affecting the eyes, that is diabetic retinopathy. This is another complication of diabetes that affects the retina of the eyes. The retina is a light-sensitive layer of cells located at the back of the eye, and they convert light into electric signals. It is these signals that are then sent to the brain via the optic nerve and then produces the images that we see. This phenomenon is interrupted with when this complication occurs. Like nephropathy, the major cause is poor glycemic control, that is, and high blood pressure. Signs and symptoms do not occur early, but as the condition progresses, blurred vision, dark areas in your vision, spots floating in your eyes known as floaters, fluctuating vision, and even vision loss can occur. Now to the last complication we'll be talking about today, that is those affecting the nerves, diabetic neuropathy. This one, like we can possibly infer from the name, affects the nerve, causing damage to it. It affects about 50% of those with diabetes. Symptoms of neuropathy includes numbness, tingling sensation, pain, and so on and so forth. Like I said earlier, these complications can be prevented. So, how do we prevent all this from happening? Prevention. The main goal of diabetes management is to prevent all of these complications from developing and to ensure a good quality of life is maintained. To do this, it is essential to go for regular checkup and annual review, maintain good glycemic control, maintain a healthy weight, refrain from smoking or alcohol use. And if there is any change at all you notice in any part of your body, in any organ of your body, please speak to your diabetes team. Moreover, if any of these complications arises, how do we manage them? So, management of diabetes complications. As every individual is different, it is important to speak to your diabetes team who will be able to tailor your management to your individual requirements, looking at the bigger picture. And just so you know, they are the best person to give you the proper advice because they know you or they have all your medical details with them. Remember, all of these complications can be prevented. They are all preventable, but even when they happen, they can be managed. Thank you so much for listening.